Charles. This is a patient who was diagnosed approximately 13 years ago. Give us a little bit about your history of this disease.
Well, at first, the first signs of it, I started to have a lot of trouble walking. I had a real stiff neck, and well, those were primarily the main symptoms. I had a very stiff neck for a while, and then I started having trouble walking. I couldn't swing my arms. When I was at work, I'd walk down the hall and I'd bump into the walls. I'd kind of have to use the wall to help me balance myself. I would start going forward and wouldn't be able to stop, and the same thing would happen. I'd just start going backwards and I couldn't stop either.
Okay.
I didn't have much of a tremor, but I do now as the medication's effectiveness is getting less.
Okay. The medications worked at first?
Yes, immediately. I took one pill and it was like I didn't have Parkinson's anymore.
And now it's 13 years later?
Yes.
And the medications aren't working?
No, I take it every 2 hours, and sometimes it works and sometimes it doesn't.
So they're losing their effectiveness?
Yes.
Yeah, okay. And then 5 months ago you had a deep brain stimulator put in?
Yes.
Yeah, tell us a little about that.
Well, it was a lot more involved in it than I had really expected, but I did get through it. You have to have the wires put in one surgery, and then about 2 weeks later, or I guess a week later, I had a battery pack put in my abdomen. And then you start going to the programmer for, for them to set the, I don't know what you call it, but the settings. They go like 1.8. Right now mine are both set at 2.2. But every time they've tried to put my settings up higher, I'll go home, and after a while I need to put it back to what it was before, because it's just, I get stiffened so badly. And that's about how it's been so far. Okay,
so basically they haven't found the right settings for you yet?
No.
Okay, so you've come to us and you want to try the mouthpiece to
right, because yes, and another thing, I've had TMJ symptoms off and on since about 1986, 87.
Okay. Show the viewing audience how wide you can open your mouth. This is 28 millimeters. Get me a ruler. What's it show here today? Okay. 28. Okay, that's her maximum interincisal opening. Now, bite down. See, she's got an 80% or more deep bite. Why these two clues were missed is beyond me. But this, I feel this TMJ problem is contributing greatly to her Parkinson's. Every Parkinson's patient I ever met has a TMJ problem. Okay, we're going to deliver her appliance a day or two from now, and then we'll monitor her progress as she goes along, and you'll be able to see her response. Do you still have trouble walking?
Well, yeah, when I get stiff because the medication isn't working, yeah, I have, when you're stiff, it's really hard to walk, yes.
Okay. How about today?
No, today I've been okay. My primary symptoms, even on off meds, are mostly from my neck up to my head lately. They've seemed to have changed since I had the DBS. Okay.
Today is the delivery appointment of this appliance. Notice the patient's deep bite, and how the first thing the appliance is going to do is correct the deepness of the bite. Open. Bite. Now with the appliance in, you can see that the teeth do not overlap and the deep bite is gone. Tap up and down. Okay. This is the initial position we're going to leave the appliance in. We have balanced the appliance already and is hitting evenly on both sides. She has 1-point contact on the left and the right side in the upper first molar area against the flat plane on the left and the right sides of the lower appliance. We are going to see this patient in 3 or 4 days for her first checkup, and we'll show you the improvement between now and then. Okay, this patient returns after wearing her appliance for 5 days. We've adjusted it, and she just told me that for the first time last night she slept for 7 hours, which is highly unusual. She usually sleeps for 4 to 5 hours maximum, but now that her duration of sleep is starting to increase, which is a common thing that we hear from these Parkinson's patients. We'll see her next in 6 weeks from now, and we'll bring you her improvement at that time. This is a Parkinson's patient who's had her lower appliance for the past 6 weeks. She had a deep brain stimulator implanted. How long ago was that put in?
In October 2010.
And they've never been able to get the settings right on it, right?
Actually, up until a couple of weeks ago, that's true, but they finally got some good settings for me.
Okay.
And they're working really well in combination with the TMJ and everything else. It's starting to kind of fall together.
Okay, but when we gave you your appliance, they did not have the settings.
No.
Which is why you got the appliance.
Yes, at least, yes, partially.
Okay. And when we put the appliance in, you had hat band headaches 1 to 2 times a month.
Yes.
For several years, and you, your big thing was insomnia, trouble sleeping.
Yes.
And you, at that time, you could only sleep, what, 2 or 3 hours a night, or
4 or 5 maybe, and then I'd get up and it was like a split shift of sleeping.
Okay, and now you're sleeping how much now?
Sometimes 7, 8 hours.
A night?
Yes.
Okay. Let's see, you had facial muscle tightness.
Mm-hmm.
Your mouth opening has increased from 28 to 33 millimeters because we measured you today.
Okay, that's great.
Yeah.
Every little bit helps.
Every little bit helps. You've had the Parkinson's, you've been on Parkinson's medications for 13 years.
Yes.
And now, in the last month, they've just decreased your blood pressure medications.
Yes.
Right? Tell us about that.
Well, I was having really bad blood pressure spikes, which is associated with the time of the one dose of medication is wearing off and the second dose hasn't kicked in yet. And in general, I was on blood pressure medication anyway, but now they found, even though I'm having these spikes, my blood pressure is really low, which is common for Parkinson's patients. So now they have decreased the amount of blood pressure medication, but I still need some because my blood pressure does go up a little bit.
And this is since you got your appliance, right?
Yes.
Okay, and you've had these TMJ symptoms for years and years and years, but no one's paid any attention to them until we started a month ago. Is that correct?
Well, yeah, I've complained to my doctors and nobody has really known what to do, and fortunately I found you, and you seem to have a really good treatment program.
Okay. Well, it's nice that you said that. That was the right thing. Tourette syndrome is a neurological disorder starting in childhood and associated with involuntary repetitive movements, which are motor tics, and vocal sounds, which are called vocal tics. Tics are also classified into simple and complex tics. We hear over and over and over again that it all starts at 5, 6, and 7 years of age in these patients' histories. The reason for this is, I think, because the patients at this age are losing their teeth. And there is nothing that says the permanent teeth have to erupt and in the exact same precise location as the baby teeth, which are being exfoliated. Many times the permanent teeth erupt in new or different positions which are not beneficial to the patient, and the normal maxillomandibular relationship, or the relationship of the mandible to the maxilla or to the base of the skull, is changed from one that is normal to one that is pathological. This is this young man's appearance from the front. This is his profile. Notice the verticalness of his upper lip and the receding lower jawline. This should tell you that his lower jaw needs to be brought forward. This is a picture of his teeth in centric occlusion. It should give you some idea of the deepness of his bite, approximately 50 or 55%, and his protrusion. This is a 9-year-old boy from California who was diagnosed with Tourette Syndrome at 5 years of age by a neurologist. Many of these Tourette's patients are diagnosed at this young age. He gives a history of having had a bad fall at 2 months of age from his kitchen counter while being bathed and hitting his head on the tile floor. This is very common because a lot of mothers bathe their babies on the kitchen counter, and then the phone will ring or some other distraction will occur, and she turns around and the child rolls over a time or two and then falls to the floor. We hear this story several times a year. He has 9 tics: eye blinking, which is one of the most common tics there is, throat clearing, coughing, arm extensions, jumping, skipping, and hopping, tensing of muscle groups, stomach tics, thrusting his groin or torso forward. And he comes in with approximately 8 tics, such as eye blinking, arm extending, jumping and skipping, hopping, tensing muscle groups, coughing, throat clearing, etc. Now look in the camera and show them some of these tics. Show them your head tics. Back like that. Do you have any mouth tics? No, okay. Like that. Okay, some more head tics. Like that. Okay. Okay. Now, how can you show us those stomach tics? Sitting or standing?
I can do both.
Okay, show them. Pull up your shirt. Okay. This is his stomach tic. You can see involuntary contraction of the abdominal muscles. Okay. And how frequent is this? Does this go on all day long?
No, not all day long.
Okay.
It just stops, like it like comes like probably for like 12 hours a day, and then at night it stops.
Oh, okay. So during awakening hours you
Yeah.
have it. Okay. Now, can you demonstrate your skipping when you walk?
Yes.
Okay. Just walk down to where your dad is and then turn around. Okay. And that's how you do it when you walk all the time? Okay. And how long has that been going on for?
I think since 3rd grade.
Since 3rd grade. What grade are you in now?
4th.
4th grade, okay. Okay, hop back in the chair. Okay. This young man returns after approximately 16 or 17 hours of wearing the appliance. You can see the relaxed muscles in his face. He reports that the majority of his tics have diminished except for his stomach tics. We increased the height of the appliance today to address that problem. This boy is 12 years of age, and his tics began at 5 years of age. He too was diagnosed by a neurologist, and he was diagnosed with Tourette Syndrome, myoclonic epileptic seizures, attention deficit hyperactive disorders, Asperger's syndrome, and acid reflux. his MRI is negative for disc displacement. That doesn't mean to me that he does not have a disc displacement in one or both joints. MRIs are only 74% accurate when they're negative and 92% accurate when they're positive. So even though the MRI cannot pick it up yet, that does not mean he doesn't have it. You have to make your decision on the clinical findings, not on the imaging findings. Other symptoms he reports are blurred vision in the morning, retroorbital pain, which is pain behind one or more eyeballs, photophobia, which means his eyes are sensitive to light. It is very, very frequently found in closed-locked TM joint patients. He complains of tinnitus, nose pain, neck pain, and back pain, pain at the vertex of his skull, numbness of his fingers, swollen lymph nodes since birth. He's got 35 tics, hopping, punching, kissing himself or others, twirling around, thrusting movements of the groin or torso, perches on his toes like a bird, sexually touches himself, sexually touches others, obscene gestures, breathing tics, self-injurious behaviors, makes animal-like sounds, stutters and voice changes, cracks neck, back, and chest. He also has eye blinking, head jerks, shoulder shrugs, tossing his hair, squinting, facial grimacing, nose twitching, throat clearing, grunting, sniffing, snoring, squeaking, laughing, touching objects, touching people, smelling fingers, smelling objects, jumping or skipping. This is a view from the right side showing a class 1 occlusion in the molar bicuspid area. This is his occlusion from the left side, again showing a class 1 dental occlusion. This is this boy's maximum interincisal opening, approximately 46 millimeters. For a person his age, the average in the scientific literature is 54 millimeters. This is a less than normal or impaired vertical opening. This is a 12-year-old young man from Seattle who presents himself for treatment. We're starting his treatment today by delivering an appliance. And you just look into the camera. He's got 35 different tics, from eye blinking, shoulder shrugs, head jerks, brushing or tossing hair, mouth opening, facial grimace, nose twitching, and so on. He's filled out a whole list of tics: throat clearing, grunting, sniffing, snorting, speaking, stuttering sometimes, twirling around, hopping, thrusting movements, etc. And you can see as he's going through some of these tics, and I haven't mentioned them all, that we want to eliminate them. He's 12 years old and he's in school, right? Mm-hmm. Yeah. And you're not aware of girls yet, are you?
No.
You will be.
Yeah.
Okay, if I fix your tics and you get too many girlfriends, I get your overflow, okay? That means the extra ones, you send to me.
Okay.
Okay. Okay, look, you want to say something to the viewing audience? Anything at all?
No.
You just hope this works, huh?
Yeah.
And hopes it works darn quickly, huh?
Mm-hmm.
Okay. Well, I'm going to promise you it does, because we can help you out very quickly. And we're going to finish polishing up your appliance right now, which is in its final stages of fabrication. And then we're going to see it tomorrow. And we're going to film you tomorrow and the next day to show the improvement already. Okay? Mm-hmm. Good.
Okay.
We are putting this appliance in now, really for the first time, on this young man. Okay, Mike. Like that. And you can notice that it has an immediate effect on his tics. It just brings him to a screeching halt if you've chosen the right position and positioned it correctly. Okay. Now we're going to see this boy tomorrow. What time's your appointment?
9:45.
Okay. 9:45 will be about 16 or 17 hours from now. and we'll see the effect in 16 or 17 hours. Does that hurt you in any way or cause any problems, any strain? You think you'll be able to eat with it, sleep with it, talk with it?
Yeah.
If it makes you talk funny, which it probably does not, but if it does, you can practice reading out loud. Get yourself a newspaper or something and read it out loud. It is now 10 o'clock the following morning after the delivery appointment, and we have the patient has been wearing this appliance for approximately 16 hours or so. And you can see that his tics are mostly gone. Tell the viewing audience what your experience has been.
It was good. I got really good sleep last night.
Speak louder, speak.
I got good sleep last night, and I haven't ticked at all, really. So.
Okay, that's pretty good for less than one day. Do you want to say something? Come on back here. Okay, this is this boy's mother, and she's going to comment on the improvement in the past 24 hours, or the past 16 hours.
Well, the first thing that I noticed was the calmness. There wasn't the ADHD symptoms. He seemed very focused, and obviously the tics weren't happening, which is like a miracle for us. He was almost like a different personality. He was very focused is a good way to say it, and calm. I have never seen him so calm. And he slept so good last night. The hotel we're staying at, there's 2 queen beds. I didn't hear him ticking all night. I couldn't get him up this morning. It was like trying to get a sloth out of bed, which is not normal for him. He's usually bouncing off the walls. So it was really a miraculous turnaround in his life. I think it's going to change his life forever. So, yeah.
Well, that's excellent. That's a good endorsement. Good. You're doing all right. We're going to have to send you out to Hollywood. Huh? Okay, girls will be throwing themselves in front of your bicycle soon when you go back home. This boy returns for his first checkup. He's been wearing it 40 hours now, and you can see from his lack of movement that he's responding well to his treatment. His tics had returned a little bit, and we've made an adjustment this morning for him. Did you want to say something?
Not really.
Okay. How about you? You ready to say something? Do you want to say anything?
Okay, yeah.
Okay.
Yeah, it's definitely working. I can see already with the adjustment that he's returning to no tics and no ADHD symptoms again, so that's good.
This young man returns. He's been wearing his appliance 6 days now, and as you can see, his tics are totally gone. You want to say something for the viewing audience?
It's helped a lot.
It helped a lot. Speak louder. Speak louder.
It helped a lot, and I don't tick anymore. So.
Okay. You think you'll get a girlfriend now? Remember our deal. If you get more girls than you can handle, I get your overflow. Okay?
Okay.
That's the deal I make with all these young guys. It hasn't paid off for me yet. Come on back. Come on here. Why don't you say something?
This has just been a life-changing thing for Dane, and we're just so happy that we came and saw Dr. Stack. It was worth the trek from Seattle. And it's just been amazing to see like almost 0 tics. You know, he's just like a different child, and it's even lessened the ADHD symptoms, and he just seems calmer and more focused and able to just, I don't know, it's hard to explain, but he just seems really happy, and it's a lot better. It's changing his life. I can see where it'll help him in school too.
He's sleeping better?
Sleeping better. Oh yeah, it's hard to even get him out of bed in the morning. We were almost late for his appointment today.
Where before he wasn't a good sleeper at all, was he?
No.
No. And you feel he's had personality changes that are beneficial?
Absolutely, yeah. It's totally different. It's a different child.
He's nicer to have around now?
Yeah.
Okay.
He is. Not that he was terrible before, but he was feeling miserable before, and now this has calmed him down. You know, just feels more grounded, I think is a good word.
Okay.
Yeah.
Yeah, and focus too.
Yeah, definitely his help is focus.
Okay.
So.
Well, you go back to Seattle and tear him up there, okay?
Yeah. We haven't seen, he hasn't had any seizures either. So.
Oh, he was having what kind of seizures? Petit mal seizures? Epileptic seizures?
Myoclonic?
Myoclonic seizures?
No myoclonic seizures.
At all in the past 6 days. Huh? And how frequently had he been experiencing those?
Probably all day long, every hour or so, or just little,
Okay, well that's a benefit right there in and of itself. He's seizure free now. Great.
Yeah. So thank you, Dr. Stack.
You're more than welcome.
Yeah.
Get on home, kid.
Yeah.
This is a young Tourette's patient with OCD whose tics began at 9 years old. He gives a history of head bobbing, lip licking, vocal tics, throat clearing, shoulder muscles twitching, a feeling like he wants to explode, snorting, back arching, etc. This is the cephalometric X-ray for this young man, and you can tell immediately by looking at his soft tissue outline with his lower lip horizontal that he is overclosed. In other words, he needs an increase in vertical dimension. Also note that the mandibular borders of the left and right sides of the mandible are not parallel and superimposed over each other. One is higher than the other. That is indicative of shortening of the condyle up here in the glenoid fossa. This boy has a decent airway going for him, and he has no suboccipital compressed tissues. The first cervical vertebrae is supposed to be on a 45-degree angle, which it is. This is this man's left tomographic TMJ X-rays. This is initial contact, and this is wide open. And we make sure that the condyle translates out of the fossa, past the articular eminence, and is separated from it by at least 2 to 2.5 millimeters. We do not want the condyle touching the eminence. These are the right tomographic X-rays of this boy. This is centric occlusion here, and this is wide open. Again, we want to check the translation of the condyle to make sure it travels past the eminence and is separated from it by 2 to 2.5 millimeters. This is this young man's submental vertex X-ray, and it shows the mandible, which is outlined here, is not located in the center of his cranial base, but is displaced off to your right. You can see the difference between how much the ramus of the mandible is inset from the lateral surface of the skull on his right side and how it is overlapping the lateral surface of his skull on this side. The whole mandible is displaced to your right. What's your worst tic that you have?
My worst tic is probably right now it's probably maybe the lip licking. Yeah, lip licking tic. What it would make me do is make me move my lip up and rub the all the saliva on it, and then it gets dry. And then when it could last about maybe about a week, depending how much it
Show us how you do it. Okay. And you do that all the time? Or most of the time?
Mostly, once in a while it does it.
Okay. And you have a head bobbing tic?
Yeah, the head bobbing tic makes me during the 4th grade I didn't know that I had Tourette's when I had my friend over. We were in the backyard. I was by the fort, and I kept bobbing my head, and I kept bobbing my head like this, and it eventually started to kind of hurt a little. And I was like, he asked me, what's wrong? What's wrong? And I said, I don't know. I didn't know, and then eventually we found out that I had Tourette Syndrome.
Okay. What other tics do you have?
Sometimes I have a certain kind of tic that, like if I'm walking through, like maybe the mall or a grocery store, kind of wants me to like go like this and bob back.
Oh, okay. Do you have any shoulder shrugging tics or any other walking tics? Or?
I used to have a tic that would have me twirl around in circles in Target.
Oh, Target store.
Yeah, it would have me. It was during also the it was during the 5th grade.
Okay.
That would make me like just twirl around.
Twirl around. Okay. Okay. Well, today we took all kinds of impressions and X-rays on you to do our fabrication of your mouthpiece, which we're going to have ready for you in 2 days. We'll send it out to the laboratory tonight, and it'll be made tomorrow, and then we'll have it back the next day for you. Okay? Do you have any questions you want to ask?
No, not right now.
Okay, good. Okay. Tell the viewing audience what your hopes are for this treatment.
I hope that this treatment can help me. What I really want to do is go on classes with my friends. I hope this treatment will decrease the level of my tics. I hope that it will really put my tics down, and that I could learn a little bit more better, because the tics, they can really get in the way of your learning skills. So I wish I could so I hope that I could learn better, go around in public more, like I won't do much as tics as a lot. And I hope that this mouthpiece would succeed, and that I would be just like a normal person.
How are your grades in school?
My grades are good, really good.
Okay. Do you have to work extra hard to get good grades?
Yeah.
Yeah.
A little bit, yeah.
Is reading hard for you?
Yeah, reading can be hard.
Yeah. Okay.
It's hard for me.
Okay. Let's leave it there, and we'll see you again when we put the appliance in for you.
Yeah.
One of the clinical signs that this patient was overclosed, or that his lower jaw was too close to his upper jaw, came on the lateral skull X-ray, which you see here. When the teeth are closed, the lower lip is supposed to be vertical, and as you can see on this patient's X-ray, his lower lip is horizontal. You can see this vast curve underneath the lower lip here. This should not be here. Whenever you see a patient's soft tissue appearing thusly on an X-ray, you can know that the patient is overclosed. Another way of saying this is that his chin is too close to his nose, and this dimension needs to be increased, which is one of the functions of the appliance which he will wear. Another clinical indication is that his overbite, or the amount of vertical overlap of his upper teeth overlapping vertically the lower teeth, is too great. It's 60%, which you will see later on in a frontal view of his teeth. It should be no more than 20% at the maximum. These are both indicators that he is overclosed and needs to have the distance between his upper nose and lower jaws increased. This young man's intraoral mouthpiece today. The question always arises, how thick do we make it, how tall do we make it, how high do we make it, And one way to do it is by putting in popsicle sticks or tongue blades and varying the height up and down to see what makes the ticks go away. Like, we have done this on him and have determined that a height of 3 tongue blades drastically stops his ticks. And so we are going to start with a height of 3 tongue blades initially for his mouthpiece. What we are going to do is mix up some acrylic, put it on this mouthpiece, and then have him close down on the soft acrylic till he reaches a height of 3 tongue blades. Open. You ready? Mm-hmm. I am loading the freshly mixed acrylic onto the mouthpiece, like so, and I'm going to put it in the patient's mouth. Open. Making sure the appliance is completely seated on his lower teeth. And then I'm going to have him close down, bite, until he closes down on the 3 tongue blades. Then open. I'm going to have him open. And I'm going to take out the appliance. And then I'm going to put it in the cooker while it hardens up. And I'm going to trim off all the excess acrylic. Okay, we have adjusted the patient's appliance, open, and we are delivering it right now. And fitting it to his bottom teeth. Right. Okay. Okay, now how's that feel? Yeah, hitting even. Yeah, okay. Good. Okay, look in the camera. Look in the camera. Okay. Now you're coming back this afternoon, right?
Correct.
Yeah. At what time?
I think like 1:45.
Oh, okay, good. That'll give him about 3 hours with it, then we'll do the final adjustment. Then you leave it. You feel more relaxed or anything like that? Yeah, good. Okay.
You could notice a difference.
Say again?
You could notice a difference.
Mouthpiece has really helped. Really helped with just it has really improved that I'm not as ticking as much. Like I would still have a few ticks once in a while, but over time it will get better. And during the 3 hours, I was like hardly ticking, and it really helped. It really helped. It really did. I'm talking fun with it, eating fine with it. It's not hard at all. It's really easy to eat and talk with it.
Ken has had the mouthpiece for 3 hours now. And he's just come back here before he leaves town, and for a quick checkup, and he seems to be progressing quite well. Okay, this young man returns after 4 months because he lives so far away. He's been under the care of another TMJ specialist out in his local area, and we rebuilt his splint today. Take a look and bite. You can see how tall we made it here. It's about 6 or 7 millimeters high. Don't be afraid to make them this thick. We made it this thick to compensate for the long intervals at which we see him for the wear and tear. And he's doing quite well. You can see he's lost all that discoloration around his lips, and his head movements have diminished greatly. In fact, they've ceased as he sits here in the chair, and this boy is responding very well, as he should.
It actually helped me really well when I just came in here. I was taking a lot more, and then when this got built up, I just really relaxed a lot more.
Tell them why you're in Washington.
Part of the reason why I'm in Washington is because I got elected for a Tourette Ambassador program. I got elected for that, so I'm going to have 2 days of training over at the state capitol, so that's going to be a really fun time.
Okay. And you're going to be meeting members of Congress, right?
Yeah. Yeah.
Good. Well, we've got a budding politician here. Why don't we have his mother say something? Why don't you look at the camera? Okay.
Hi, I am Kenny's mom. I'm Carla Richards. I was elected Mrs. Washington last year, and my platform was embracing the special needs child. And part of that, of course, is advocating for my own son who has Tourette's, which is why I met Dr. Stack after doing research and found out an alternative treatment for Tourette's. So we came here last November, and before we met Dr. Stack, my son, one of his large motor tics was doing circles down the aisles of Target, for instance, or he would jump back like he had a string pulling on his back, so it'd take a long time to shop at the grocery store. But he no longer has those large motor tics, so that has been a huge blessing. The challenge, of course, is just being able to keep up with follow-up appointments, and not everybody on the West Coast knows of Dr. Stack's procedure, so we are trying to educate them as well. So it just so happens we're killing 2 birds with 1 stone. My son got elected to represent the state of Washington at the National Tourette Syndrome Association Youth Ambassador Leadership Program. And my son and I, we also started a support group together, so he reaches out to the children and I reach out to the parents. Although he reaches out to the parents too and gives them encouragement. And so we're hoping after this training we'd like to go back and visit schools and educate parents, teachers, and students on Tourette's, how to advocate and empathy skills, and of course how to implement programs as far as the teacher's perspective, and of course to educate people about this alternative treatment as well. So we are very encouraged, and we're just taking it one day at a time, but so far everything's looking good. So just seeing him right now, it's a relief that I see him having some relief from getting an upgrade to his the level of his retainer. So